Welcome and thank you for joining the Mississippi State Department of Health for a brief presentation about oral COVID-19 therapeutics. In this presentation, we will cover the drugs themselves and their dosing, their target populations, safety, drug-drug interactions, use in special populations, and the accessibility of the drugs. We will also present a decision tree that guides use of all available COVID-19 therapeutics. With the oral antiviral medications, an attainable goal is to transition care of most mild to moderate COVID-19 infections in high-risk populations away from parental care in hospitals and into the clinical primary care setting and pharmacies. All the links and resources in this video presentation can be accessed by navigating to the Mississippi State Department of Health website, the COVID-19 page. As seen in this screenshot of the site page, select the online resources mentioned in this video tab to review the links. Two oral antivirals, Paxlovid and Lagevrio, were made available by the federal government in late December 2021 at no cost to the state of Mississippi or individual patients. They are used to treat mild to moderate infection with SARS-CoV-2 virus in the outpatient setting and at present are accessible at retail pharmacies for a minimal dispensing fee. Paxlovid is a combination of nirmatrelvir, a protease inhibitor, and ritonavir, a CYP3A inhibitor. Protease inhibitors first received FDA authorization in 1995, and their mechanism of action is to bind to protease enzymes, resulting in prevention of viral replication. Protease inhibitors are used successfully in the treatment of HIV infection. The CYP3A inhibitor in the combination Paxlovid increases the plasma level of the protease inhibitor. This latter class of drugs includes erythromycin and clarithromycin. Lagevrio is a nucleoside analog, another drug class that has been in use for a long time, since 1987. It halts viral replication by mutagenesis, tricking the virus into creating errors in replication. This class of drugs also successfully treats HIV, varicella zoster, and herpes simplex infections. We encourage you to read the emergency use authorization fact sheets for healthcare providers for both of the drugs. These are linked in the online resources document. Briefly, Paxlovid can be used to treat patients with mild to moderate COVID-19 infection who are at high risk for progression to severe disease, who have a positive rapid or PCR test for SARS-CoV-2 and are 12 years of age and older and weigh at least 40 kilograms. Lagevrio can be used to treat patients with mild to moderate COVID-19 infection who are at high risk for progression to severe disease, who have a positive rapid or PCR test for SARS-CoV-2, and are 18 years of age and older. When alternate COVID-19 treatment options authorized by the FDA are not accessible or clinically appropriate. Both drugs must be initiated within 5 days of symptom onset. The online resources document entitled People with Certain Medical Conditions, CDC link, is a list of conditions which place an individual at high risk for progression to severe disease. Limitations of authorized use include initiation of one of the oral antivirals in an individual with severe or critical COVID-19 infection who is or should be hospitalized is not indicated. Use as pre or post-exposure prophylaxis is not indicated, and use of these products for longer than 5 days is not indicated. Links to efficacy trials are available in the online resources document, And as you see, Paxlovid reduced risk of hospitalization and death by 88% and Lagevrio by 30% when the drugs were given within 5 days of symptom onset. These medications do require an encounter, which may be virtual, with a prescriber who may be a healthcare provider or state licensed pharmacist. A valid prescription must be issued that includes the date of symptom onset. This ensures the prescription is filled in the 5-day window required in the emergency use authorization. Patients need to receive the fact sheet for patients, parents, and caregivers, and links to these are provided in the online resources document. Pharmacists who prescribe Paxlovid must adhere to the Mississippi State Department of Health standing order, which is linked here. The department standing order is based on the July 6, 2022 FDA update to the COVID-19 therapeutics emergency use authorization. With regard to dosing, providers should stress the importance of starting the medication regimen immediately upon receiving and filling the prescription and the importance of completing the regimen. The drugs are dosed as outlined here. With regard to safety, both drugs are safe and the adverse effects are primarily GI. Dysgeusia or bad taste can cause premature discontinuation of Paxlovid, as can any of the adverse effects. These effects will resolve when the regimen is completed. Drug-drug interactions are very important with Paxlovid, and common drugs causing them are outlined in the following slides. Paxlovid contains a CYP3A inhibitor, so it may increase concentrations of drugs metabolized by CYP3A. Also, medications that inhibit or induce CYP3A may increase or decrease Paxlovid concentrations. Please go to the links on these slides to review all medications that can present an interaction when you review a patient's drug list as you consider appropriate treatment for mild to moderate COVID-19 infection in the outpatient setting. This slide illustrates prescriber tool links found in the online resources document, which can make assessment of individual medications' interaction with Paxlovid easier and quicker in a real-time clinical setting. Medications on this slide may be able to be withheld for 5 days, so a course of Paxlovid can be provided. If not, you will need to consider alternative treatment of the infection with your clinical discretion. Drug-drug interactions are not an issue with Lagevrio. Next, we will review several special populations to be considered when prescribing the oral antivirals. The first is patients with renal impairment. No Paxlovid dose adjustment is required in normal renal function or mild renal impairment. In the presence of moderate renal impairment, a renal dose blister pack should be prescribed. If this reduced dose blister pack is not available, the number of tablets dispensed in the regular blister pack must be adjusted by the pharmacist. The prescriber's prescription will guide this adjustment by reducing the ordered dose of nirmatrelvir to 150 milligrams twice daily in combination with 100 milligrams of ritonavir. Paxlovid is contraindicated in a patient with severe renal impairment and in a patient with severe hepatic impairment resulting in decompensated liver failure. Lagevrio requires no dosage adjustment in the face of renal impairment. Another special population is pregnant individuals. There is no available clinical data on pregnancy and the use of Paxlovid, but in animal trials, offspring had reduced birth weight when exposed to doses 10 times the authorized dose in humans. Lagevrio should not be used in pregnancy because mutagenesis is its mechanism of action. Those using family planning are the third special population to be addressed today. The ritonavir and Paxlovid may reduce the efficacy of combined hormonal contraceptives, so an alternate method of family planning should be discussed with a patient of childbearing potential. Because Lagevrio is a nucleoside analog and its mechanism of action is mutagenesis, an individual of childbearing potential should have a pregnancy test prior to prescribing the medication. If the test is negative and the drug is prescribed, the patient should be counseled to use a method of contraception correctly and consistently during the 5-day treatment and for the following 4 days after the last dose. Males of reproductive potential should use a reliable method of contraception when sexually active with individuals of childbearing potential for 3 months after the last dose. This slide has the link found in the online resources document that leads to the age-dependent decision trees that are presented on the following slide. Color-coded decision aids take the presenting patient through pertinent clinical scenarios to aid you in selection of the COVID-19 therapeutic that is best for him or her. A therapeutic locator tool is available on the Mississippi State Department of Health website, so you can direct patients to pharmacies that have the therapeutics on hand. CVS, Kroger, Walgreens, Walmart, and Winn-Dixie pharmacies have supply. Also, many independent pharmacies have oral antivirals, as do select FQHCs and hospital systems designated as centers of excellence that have outpatient pharmacies. Paxlovid's shelf life has been extended by the FDA, and lot numbers are referenced on this slide. In closing, this is another screenshot of the Mississippi State Department of Health website where valuable resources are available to assist you in use of these effective available products. Here, please find listed links to documents referenced during this presentation. Please direct any questions that you have about COVID-19 therapeutics to us using the contacts listed on this slide. We will work to answer them or direct you to other resources who can assist you in outpatient care of mild to moderate COVID-19 infections. Thank you for the time you devoted to reviewing this presentation.